Transform your health, reduce chronic diseases, and improve your well-being. Learn from leading health experts, researchers, and practitioners as they share cutting-edge information and advice that will help you make informed decisions. Join Mary, the Slim Diva, every weekday from Mondays to Thursdays at 11 a.m. on Echo FM 100.7 Owerri. Health Revolution, your daily tonic for healthy living.
Echo FM 100.7.
It's another lovely Thursday morning, 23th July. I'll never say September. 23 July 2026. How are you this morning? Good morning to you. Thank you so much for your company and thank you for joining us on today's edition of Health Revolution. Buru Buru One, I salute you as usual. Thank you so much for handing over to me this lovely Thursday morning. My name as always is Mary Omeni Wode. You can call me the Slim Diva, your most adorable. And DJ Boy is here in the studio with me this morning. Together we'll make the next, 45, 50 minutes plus. Very, very worthwhile and interesting. And before I go ahead to introduce our guest for today and tell you about the topic for, today as well, I would like to drop the update. We have some health update I know will be of great interest to everyone listening at this time, either via Radio Garden, via the website, or via the frequency 100.7. We're also live on Facebook at Echo FM 100.7. Go like, share, and drop your comments the moment I open up the phone lines and begin to ask questions this morning. So it's no longer news that the National Agency for Food and Drug Administration and Control, NAFDAC, has commenced a nationwide mop-up exercise to remove alcoholic beverages packaged in sachets and PET bottles below 200 milligram from circulation across the country. Now, in a statement that was issued yesterday, the agency said the exercise reinforces the federal government's ban on the production, importation, and sale of such products in Nigeria. According to NAFDAC, its enforcement teams are conducting coordinated operations in markets, motor parks, retail outlets, bars, and other distribution channels to identify, seize, and destroy the affected products. So if you know someone that knows another person that sells the PET bottles below 200 milligram or milliliter rather, for alcoholic beverages, or even the sachet alcoholic beverage that we all know, tell them that NAFDAC has commenced enforcement on the ban of such things. They don't want to see it in the open market, in motor parks, in bars. Yes, they don't just want to see it, and it's been banned by the Nigerian government as well. Okay, and then we move on to Lagos, where we are getting a very, very good information that says that the Permanent Secretary, Lagos State Office of Transformation, Creativity and Innovation, by name Oluwatoyin Ademuyiwa, has warned that any Lagos resident who attacks medical personnel in hospitals across the state will risk imprisonment, stressing that the government will not tolerate assault on healthcare workers. And Ademuyiwa gave the warning yesterday during a maiden stakeholders meeting of the Federal Medical Center, Epe, Lagos. And then in that meeting, a lot was said. The permanent secretary also said that violence against health workers was particularly disturbing at a time many doctors were leaving the country for greener pastures abroad. So she went on to urge patients and their relatives to build trust with the healthcare providers through effective communication, noting that treatment could only be successful when patients openly discuss their health conditions with the doctors. The message is clear. Let us stop assaulting healthcare workers. I know I have treated this as a topic on Health Revolution at some point, and I told you that the more you get angry and pour all your anger on the doctors, on the nurses, especially for people who get to lose loved ones in the hospital. I know how emotionally draining it could be at that point, but still we advise that you do not pour all your frustration on the nurses or on the doctors. I beg you, do not do that. There are not so many, like in those days when we're growing up. They keep leaving the countries in droves. So you assault their colleague and they see how, you've assaulted their colleagues. They might decide to leave. And that's not what we want. We're trying as much as we can to encourage our healthcare workers so that they will stay put here in the country. Okay, and then the last update I will be giving this morning, I just want to say this so that people will be very, very careful. Most times I hear people say, oh, I heard that FMC, maybe Owerri or Abakaleke or Onitsha, one, state or the other is recruiting for staff. And then because you're in dire need of a job, you're desperate, you then go ahead and pay any amount of money, without first doing your investigation to find out if that job is actually true or maybe a scam. Now, a 39-year-old man by name Udeme Ekpeme has been arrested by the Cross River State Police Command for allegedly impersonating a medical doctor and defrauding a woman of 500,000 naira with a false promise of securing employment for her children at the University of Calabar Teaching Hospital. Now, this was actually, made public by the Public Relations Officer, ASP Sunday Etiopa, who said the suspect was arrested by Officer Division, Calabar South. The bottom line is that this particular young man actually used false claim to deceive the woman into parting with a sum of 500,000. He just told her, you know what? I'm a staff of this particular hospital and I'm going to help your children get the job. So all you need to do is pay the amount I'm asking for, which is 500,000 naira. And the woman parted with the money without doing proper or carrying out proper investigations to actually ascertain if that information was true or false. So as we speak right now, he has been arrested and investigations are ongoing. Okay, shall we go over to the topic for today? A topic that I know will be of great interest to everyone listening at this time. It's going to be more like two topics in one. I would want us to first of all talk about the rising cost of childbirth in Nigeria. Yes, we can no longer shy away from this. It's a problem. You go to the hospital as a pregnant woman, and then you register for antenatal, you want to give birth, only for them to bring your bill, and you'll be wondering what's going on. It's something else, and I don't think that people have been talking about this, much. Nobody seems to be talking about this, right? So we'll be talking about the rising cost of childbirth in Nigeria, the pre- and post-delivery challenges that pregnant women and prospective or expectant mothers get to face while, either before delivery or after delivery. So are you aware that in Nigeria, at the moment, childbirth has become an unaffordable luxury? What does that mean? There are some people that can no longer afford childbirth. Should it be so? We'll get to find out. And then according to reports in one of the newspapers I stumbled on this morning, Nigeria is one of the most dangerous places in the world to become pregnant or even give birth. You want to find out why? We'll still talk about that. And as part of challenges these pregnant women face, according to the United Nations, and the global health agencies, this particular statistics I have here says that about 1 in every 100 Nigerian women dies during childbirth or within days of giving birth. So we'll get to find out, does this mean that there are certain mistakes that are made right after delivery? We'll get to find out from our guest today, and I want to try as much as I can to get connected to her, and I hope earnestly that network will be favorable to us this morning while we try as much as we can. People who listen to this program should know that name is synonymous with Health Revolution because she has always been there backing up what we do, and she tries as much as she can to sensitize the public at any given opportunity. Good morning to you, Nurse Esther. Can you hear me?
Yes, good morning, the Twin River.
Good morning. How have you been? It's been a while.
Yeah, I'm fine. How are you too?
I'm okay. I'm doing great. It's good to hear your voice once again. And Nurse Esther is a nurse, a midwife, a reproductive health provider. In fact, I call her a specialist in anything that has to do with maternal and child health. She's always willing to sensitize the public on issues that affect both mother and child. It's good to have you join us this morning, Nurse Esther.
Thank you very much. It's my pleasure.
Okay, so quickly, let's delve straight into the conversation. I'd like us to start with the rising cost of childbirth. Nurse Esther, I know it's your field. I know that for people like you and others that have private clinics, I don't even want to talk much about government, institutions now. For the private clinics and all that, is there a range? Is there a law that binds the proprietors or owners of these hospitals and say, you know what, we are pegging this amount for delivery, and everyone would have to stick to that? Why I'm saying this is because almost all the hospitals I know charge different amounts for delivery. Yes, in Imo here, I've done my background investigations and I also found out that Hospital A might be charging, for instance, 500,000 for cesarean section. You go to Hospital B, they are charging almost 800,000, and you're wondering, is it not the same cesarean section that somebody did in the first hospital? I don't know if you understand my question. So why is this so? Why the disparity? Why? We just want to find out this morning. Let's start from there.
All right, ma. Thank you so much. What you said, I have experienced it because some people will come to me and say, my previous baby, they charged a huge amount of money. The second one, the money was lesser and all that. So when you are talking about the discrepancy in the price or cost of child delivery, I think it has to do with individuals. When you go to the government hospital, their prices differ. For instance, state and federal, their price of delivery differs. And me, I'm thinking is because we don't have a regulatory body guiding this union. If it is where something is being organized, each hospital, government hospital, should have a stipulated amount they will collect in safe vaginal delivery and cesarean section. Then when you come to private, there should be a regulatory body too that will be monitoring the cost of delivery. Let us leave other medical cases aside. Delivery, I think because we don't have regulatory bodies, that's why everybody will, come up with a different price and fix in their hospital. For instance, someone may give birth this year and pay through SVD, safe vaginal delivery. The person may pay like 40,000, but in the next 2 years, the person will be paying like 100,000.
Okay.
And now, outside having a regulatory body for this union, the cost of living in Nigeria is becoming so much that what you buy today for 20 naira, if you go back the next day to buy it, the money will increase. And the government in private hospitals are not helping them, like when you talk about overhead costs. You have to pay for bill, NEPA bill, you buy diesel, you pay your staff, you pay for house rent and all those things. So when the owners of these private hospitals consider these things, they will look for a way to adjust their bills so they can foot these bills.
Okay.
But if it is something we'll have regulatory body and then the overhead costs, things will be normalized. Previously, we were buying a liter of fuel, I think 900 and something naira, but now it's 1,000 something. So some hospitals, private, will run it all through the night. In fact, they have 24-hour 7 power supply. How are they generating the money? It's still the patients. Remember that where two elephants are fighting, the grass will always suffer it. So, yes, apart from some people being greedy in this system, the whole problem is coming from there is no regulatory body that will supervise what these institutions are doing.
Okay, so you have stated the obvious, and you're saying that if these regulatory bodies are actually active in not just Imo State, in Nigeria, somehow this amount, or the amount for the bills or the childbirth, what is it called now, amount will be reduced to its bare, at least it will be affordable, especially for people in the rural areas. Now, as part of the challenges, right, as part of what we are saying this morning, as childbirth becomes increasingly unaffordable, you find out that many pregnant women will want to seek cheaper alternatives by going to traditional birth attendants that are not, fully trained, or even unlicensed maternity homes, even unskilled providers, because when they go to the hospitals, they find out that they are unable to pay up the bills, and then they would have to, have a second option that will take them to these unlicensed maternity homes. Do you agree that it's one of the challenges that could be pushing these women to taking such decisions?
Yes, I will accept partially to what you have just suggested. But remember in our last program that a man called, the brother's wife, and one relative like that has given birth to 8 children all at home. That going to hospital is a waste of money and time.
I remember.
So I think ignorance and poverty is another factor that will influence that. Another one is in these rural areas, if we have primary healthcare centers that are functional, it's going to reduce the cost of delivery in Imo State, per se, in Imo State. I was opportune to visit one local government or community like that. I saw a standard building, in fact, a standard health center. I was asking them, is this a private health center? They said no, but at the end of those days, that place was locked up. People were still visiting TBAs. Why? So when the government failed to do what they are supposed to do, people will suffer it. If we have in all the 27 local governments in Imo State, if we have functional and well-equipped primary health centers, believe me, these ones in the rural area will assess them, and then they will go home happily. Now, when you cannot assess, or when you get to that place, I think last week someone said she went to immunize her child in a primary health center. All they were asking her was, give me 500 naira for this. Give me this for. They did not even ask the vital information. I was asking her then, what kind of medicine, what kind of vaccine were your child immunized with? She said she don't know. Didn't they teach you? She said they didn't teach them. All they were after is the 1,000 naira and the 500 they were collecting. Yes. So you see this kind of thing. If government fail to recruit the skilled personnel and push them down to these rural areas, we will continue to face these challenges in the high cost of delivery. Normally, it is not supposed to be like that. But because we have left what we are supposed to be minding, and minding are different things. You cannot build a structure and say this is a health center. No staff, no qualified personnel is working. There is no items to work with, no equipment to work with. So it is a challenge. Patients will go and still fall back to the hands of these TBAs. And now the cost will become so high. If the TBAs mismanage them, eventually they are rushed to the hospital as emergency. You see, the cost will increase. Then they will come out and tell you how much they are being charged without telling you the circumstances behind the bill.
Exactly.
Do you understand?
I get
then another one is still on government. You know, medical personnel are traveling abroad to seek for greener pasture. If this place is conducive enough, they will not be traveling. And when you go to the hospitals, we are short-staffed. When I was working in the government hospital, it was one nurse per shift.
One nurse per shift.
One nurse per shift, yes. I worked in emergency pediatrics unit.
Wonderful.
It was hell, yeah. You go to work, go back to your house, and you'll be useless all through the day because you need to sleep and have strength.
Oh, no.
So it's not that we don't have nurses roaming about. but someone in the position is occupying it for future children who are still in school.
Okay.
All right, instead of recruiting those ones available. So if we should have regulatory bodies, ensure that we have qualified staff posted in these health institutions. These stories of high cost of delivery will be low. When the pharmacists remember the cost of childbirth, they will say, maybe we have to sort for a local place.
Yeah.
Some of them will stay at home and give birth, and the complications will arise without them knowing. Have you come to notice that we are having special needs children rising on a daily basis?
Very
It's
true.
because of complications. So the government should regularize what is happening in the health sector and make things easy for the poor masses.
Okay, I know that's the essence of this conversation, and I'm glad we are having this conversation. Trust me, they listen. They hear everything we say on this station, and let's hope that they will do the needful. Now, you mentioned the case of a lady who complained and said she went for immunization, and they were only interested in collecting maybe 500 naira or 1,000 naira from her. I've also heard complaints from expectant mothers who most of the time are compelled to purchase surgical gloves, disinfectant, detergents, and other consumables. Now, they also allege that at the end of the day, after buying these things, they don't even use them. They don't get to use them. So I don't know if you have come across such in the field of, in your course of working as a nurse.
Yes, I have. In fact, one came down from Oka, because of distance. So they said they want me to manage, just dressing the wound after the major treatment has been done. They came back with lots of surgical gloves. They came back with dressing packs. In fact, they were now the ones. If I say bring normal saline, they'll tell me we have already. If I say, we are going to need surgical blade, they say we have already. But you are not a medical practitioner. How did they acquire this?
Okay.
They say they paid for them in the hospital. In fact, one man had to bring, if I'm not exaggerating, like 20 pieces of that examination glove. The man brought it with infusions. Said this was what they charged in the hospital, and they did not use it. Now, this one is overcosting, and patients will be mandated to purchase them, even when the cost is not effective. This one is greedy. It's greediness.
Oh, no.
How can you tell a patient to buy what you know you cannot use? Yes, in the profession, we used to do it that instead of you to run out of the materials, it's better you have excess in case any emergency comes up. But over giving people the bill of what they should protect is not good. Is not good. So those people in charge or those people who write these things out, they should consider the cost or the grief in these patients' pockets when they are bringing it. Some of them will have to go and borrow money so they can buy. At the end, you are not using it, and they don't know what to do with it again. It's a waste of resources and money, making the patients go home with anger even when you are treating. One thing with this our medical practice is when you are treating a patient and mentally, psychologically they are not stable, all you are doing is just a waste of time.
Very true.
Sometimes they will tell you that leave us, let us go. When we get to our home, we'll be better. And you see that happen. It's not a magic. Psychologically, emotionally, that patient is not comfortable because of the way you are treating them.
Yes.
Do you understand? So these things are challenges we'll see. Yes, I have encountered it on several occasions. So please, those people that will cost, the doctors that will request, they should just readjust. I will suggest each one you want to use at a specific time, request for it. I'm not writing maybe this patient will stay for 1 month. You write the whole thing to be purchased within that time. At the end, that person will leave within 1 week. So please, let us break down how we build patients.
Okay, thank you so much for that. Before we go ahead to talk about the pre and post delivery challenges and all the mistakes that we make, especially African mothers, for women who plan to get pregnant, right? And they're listening to you this morning, Any tips on how they can plan properly so as not to get stranded after delivery? Yes, because some women do not plan. All they know is, I want a baby. And before you know it, if they are lucky enough to get pregnant, 3 months, the first trimester is gone, and they start to run helter-skelter, planning on how to, make up the money for delivery. So any tips for them?
Okay. We have lots for them. As long as a woman becomes pregnant, 2 things are involved. Either you deliver as planned or it becomes an emergency. Another one is either it is through the vagina or through cesarean section. So when you are planning, we say complications arising from this. You are anticipating, not that it is something that will happen, but you must plan towards it. Complicated readiness. So one thing is, if you are living in a compound and you are in enmity with everybody, try and make peace. Because you wouldn't know the condition you will be in when the labor starts. Maybe your husband will not be there. It is now that neighbor that will help you, and nothing is there. You are not in good terms with them. Then, mobility. Make availability, make plans for mobility in case the labor starts in the midnight, that you cannot find your way easily to the hospital. Make mobility very, very, let it be so close to you. Then another one is somebody that will stay with you during the time of delivery. Okay. You will need an assistant, yes. So if you have someone, maybe, for instance, you are not in good terms with your mother, sisters-in-law, please find someone that is very close to you, because this one will have effect even after delivery.
Very true.
Must have heard some people saying that I delivered and 3 weeks my breast milk did not flow. It's because emotionally you are not stable.
Okay.
Some people will have those ones they are not in good terms with presenting. Once you are seeing them, anxiety will release, and then breast milk production will be inhibited. All right? So make people that will stay with you available. Let there be someone that will stay with you during this period. Then another one is cost. From the day one conception has been confirmed, please try to save money. Save money so you will not run into emergency. And when you are targeting a hospital, ensure that hospital you can afford them.
Okay.
It's not, you are earning 10,000 naira every year, and you are going to a hospital that will be billing you 1 million.
1 million.
You will end up losing your hope or your faith in that hospital. So make a proper planning before you go to the hospital. Another one is attending antenatal classes. And after delivery, this idea of you must use hot water on your pee. You must apply hot water.
Okay, can we now link that? Now we are trying to go into the second part of the conversation as fast as we can before we open up the phone lines. Mistakes that women and mothers-in-law or women generally make during or mugo. We cannot overemphasize this. So go ahead and enlighten us.
Okay. So those things, you must drink alcohol for bad blood to rush out. You are going to take pap for your breast milk to flow. You will take palm wine for breast milk to flow. If you don't tie wrapper on your tummy will become so big. If you don't sit on a hot water on a strong bench, that place will become open. These things are mere. They don't exist. If you attend antenatal classes where they teach, where you will go eat buns and gossip and show up, go to where they are teaching. You will know that taking alcohol after delivery will pose a danger on your child, leaving that child with alcoholic syndrome, fetal alcoholic syndrome. Then that child will start behaving like a drunkard in future, because that alcohol you are taking crosses the blood-brain barrier. Okay. That child will definitely take it through the breast milk, and your baby will be sleeping all through the day. You will say this baby is not disturbing, never knowing that this child is intoxicated with the alcohol you are taking. Meanwhile, it doesn't have any effect on your uterus. Now, taking the alcohol with the intention of it's going to flush out bad blood. Remember, anything that will cause excessive contraction and retraction of the uterus will leave you with anemia. After delivery, we do what we call estimated blood loss. Yes, a pregnant woman is not supposed to lose more than 500 ml of blood. But when you now go home and start taking those things, your blood level will drop. And that's when they will say the devil has come to fight them.
Yeah.
Another one is application of that hot water. We have so many layers in the abdomen. Abdominal cavity is different from the uterine cavity. So these things we are taking, we are applying on your tummy. They won't even pass into the epidermis. Not to talk more of other layers in the stomach and now to the uterus. It doesn't make sense.
Okay.
Go and breastfeed that child. As long as there is contraction and retraction of the uterus, there will be reduction in the size of your abdomen, except for people with a natural big tummy. Yes, we are going to have little change as someone who has delivered. Then another thing, in the essence of they want to reduce the size of their tummy, is going to skilled personnel that will ask you to push when you are supposed to push.
Okay.
When you end up in the hands of these quacks, they will subject you to internal pushing, and then you are overstretching the abdominal muscle. They will become fluffy at the end of the day. The retraction will be so difficult, thereby exposing you to afuku, that is big tummy. Yes. So it is good patients go to where they will lay and take care of themselves and know what is happening at any slightest time. Another one they do is sitting on hot water. For instance, someone has come to me with a wound breakdown. What happened? She got home. Her mother subjected her to that hot water application in her vagina.
Oh, no.
And then the sutures we are using now are not like those ones they use that you are going to lose after 1 week.
Yes.
These ones are going to melt with your body. You are not losing anything. And once hot water is applied, it will break down, leaving that place very open. Trust me, the after pains is something you cannot bear. All right, when you end up in the hands of these quacks that will suture it without anesthesia. So this then sitting on that hot water, it doesn't have any effect. Rather, it's going to pose danger on them. So these are the things mothers do. Then drinking of these their local concoctions, they don't have any effect positively on the woman. Rather, they can endanger the life or the brain of that newborn,
baby,
making them to become intoxicated.
We will continue with that. Now you've heard from Nurse Esther. I just hope that going forward, people would learn to do the right things. I have heard people say this a lot, that when a woman in her 8 months of pregnancy gets to take abo, in fact, they make reference to a particular sect in the country, and they say, you see these people from this part of Nigeria, there's one special abo that they sell. The moment this pregnant woman takes that abo in her 8 months of pregnancy, the baby will be very small and it will be easy to push. Now you have stated the obvious, that it can go on to affect the fetus. Okay, time to open up the phone lines this morning. And if you've been listening to the station, you're listening to Echo FM 100.7 Owerri, the station with fair and balanced reporting. The program is Health Revolution, and Nurse Esther is our guest this morning. We are talking about a lot of issues, actually. The rising cost of childbirth in Nigeria, pre and post delivery challenges. 0911 20022, 0911 20022, or you call 0707 454 1014. Let's see who we have here this morning. Hello. Okay, sorry about that. Hello. All right, the phone lines are jamming. Hello.
Hello, good morning.
Morning. You're welcome. What's your name, please?
My name is Goodness. I'm calling from Irete.
Goodness and mercy shall follow us. Go ahead.
Amen. Rising cost of delivery is really something else in this country, honestly speaking. I recently have my baby in one of the government facilities recently, and I was shocked at the bill that they gave me.
Egole, how much?
It was 53,000 naira, and very smooth delivery, no stress. It was very smooth delivery, no stress.
Okay.
I was shocked when they brought bill and they said 63,000. I said, hey?
Wonderful.
And I
Wonderful.
bought all the things they asked me to bring. It was very surprising. Why the one that senior this night, when I gave it to him in the same government facility in my community, it was just like 12,000 naira charge plus circumcision.
Okay.
So I don't know. The government should please do something about it. It's really, really overwhelming, honestly.
I agree with you. Thank you so much, Goodness from Irete, for calling in this morning. And she says that when she had the most recent baby, she was compelled to pay 53,000 naira. Nurse Esther, you hear that one? We'll come back. We'll come back to you. Sorry. Hello?
Hello.
Move away from your radio set, please. What's your name?
My name is Juliet.
Your name is?
Rodba.
Oh, no. Please, if you want us to talk, move far away from your radio set, okay? Call me back. Hello?
Hello, good morning.
Good morning to you. What's your name, please?
This is Kingsley calling from Ikenebu.
It's good to have you join us. Go ahead, Kingsley.
Yes, I have a question, please.
Go ahead.
What about these women that take this miracle after delivery, like miracle G, all those things? Is it okay, or it's also harmful to the body of the woman?
Okay, thank you so much. She would answer in a few minutes, okay?
All right.
Thank you, Kingsley. Keep your calls coming in. We are live on Facebook. You can go drop your comments. Even you can drop your comments on WhatsApp as well. 0707-491-3438. And I'll be here to read out your messages. Good morning to you.
Good morning, Mary.
Yes, you're welcome. What's your name, please?
My name is Precious. I'm calling from Weather Junction.
Go ahead, Precious.
Okay, the thing is that the rising cost of childbirth in Nigeria, like, it's really high. It's really too much. Because when I had my first child last year in one of the private hospitals in Owerri, like, the bill was too much. Before I gave birth, though I gave birth on my own, it wasn't stressful.
Okay.
But before I gave birth, my husband made a deposit of 50K.
Okay.
And after I gave birth, they now brought a bill of 162,000 for us.
Okay.
I was asking myself, how? Because I thought 50K was everything, and the next thing I saw a bill. So
How many days? How many days did you stay in the hospital?
It's just 2 days.
Okay, 2 days.
Just, yeah.
And apart from maybe the regular medications, there was no emergency or complication, right?
No, there was not any emergency.
So 152,000 naira was what you paid. Was it, alongside the 50,000 naira or apart from the 50,000?
No, apart from the 50,000 naira.
Okay.
Yeah.
Thank you. Thank you for calling this morning. I appreciate you, Precious. Hello, good morning to you. Yes, please. What's your name? Good morning.
Good morning, Samuel from Nazareth.
Go ahead, please, Samuel.
I want to appreciate you
Thank you.
for the program.
Thank you so much.
I also say thank you to Nurse Esther
She can
for
hear
her
you.
explanation. You see, by the grace of God, my wife has given birth to 2 children.
The noise at the background is just too much. I don't know if you can move around a little, please. I beg you.
We are in the market.
Oh, quickly. Okay, go ahead, quickly.
Okay. The place we went to deliver is a government hospital, a specialist hospital over here. So the only issue I have there is the way of collecting 1 or 2 naira each time you appear. Are you getting me?
Go ahead quickly. I can hear you.
They will try to find something that will make you give them money. But for the charges after delivery, it was not too much on me.
Okay.
I will test my book. It was not too much on me. In fact, I happened to meet with 2 ladies that are good-spirited. So they even made the things easy. I still communicate with them up to today.
Okay.
So the the other items we are talking about that they tell people to, the hand glove and the other this thing, they are in my house now. We are not using them. But we bought them.
Okay.
Even the other, the medicine, they said I should go and get inducement drugs. So the one we bought, they do not use it. But the woman carried it because my wife delivered smoothly.
Okay.
So I just want to advise, if they are listening, those people, let them not think that what they are doing is not important, that they will make money out of it more than relationship. Like those people I told you now. That
Try to summarize. Samuel, please, summarize, please.
Yes, I'm summarizing, please. I want to let them know that their services is more important than the peanuts they collect. Because if we have a relationship with them, we can give them more than what they expect when they are collecting from us like that. Thank you.
Thank you very much. He says relationship with your patient is key, because if patients do not come to the hospitals, how would you see your money? Hello? Yes, please, speak up. Speak into your mouthpiece.
All
What's your name?
My name is Mr. Kingsley. Can you hear me?
Yes, I can hear you. It's better now.
All right. Actually, with all these things, I still believe, that most of these doctors, they have private pharmacies around hospitals. So sometimes they keep sending patients there, because what I'm telling you, I had this worst experience. I don't want to call names of hospitals. Even one of these days, this year my wife gave birth and I paid about 252,000 naira only for bill.
Okay. Was it a cesarean section you had?
Just free delivery. She went there around 7 a.m. By 7:30, she was done.
Okay.
And we came back in the evening. I paid about 252,000 naira.
Wonderful.
You understand?
Yeah.
And this hospital, I don't want to mention, it's one of the government hospitals in this Imo State. That if you come to my house, you see hand glove. So many drugs. I'm telling you, many drugs. Everywhere in my house, there is one that I didn't throw away. They know that they were not going to use it, but they will keep sending you so that they're making money. And this thing is very bad. Most of them are listening to us now, but they don't care, because it is their way of making money. It's very, very bad and barbaric. For every one of them will be mentioning Tinubu is a bad president. But they are worse than that Tinubu himself.
Oh,
you understand?
Take it easy.
Bad.
Okay. Thank you so much, Mr. Kingsley. I know how annoyed and angered you are at this moment, but trust me, we are heading somewhere, okay? I know that most times it could be very, very emotionally, draining and annoying to come here to talk about things like this, but trust me, they are listening. And I hope that after this program, the Ministry of Health or whoever is in charge would actually try to go around the hospitals and do their investigation and know how best to curb all of these things we are talking about. Nurse Esther, please, are you still with us?
I'm here.
Okay, so what all of them have complained about is not far from what you said. The first caller, Goodness, says she spent about 63,000 naira in a healthcare center. She had a baby recently. And then Kingsley asked a question. I will tell you about Kingsley's own. But Precious from Wedra said her husband deposited 50,000 naira. And after spending 2 days in the hospital, they were brought a bill of 152,000 naira. Separate from the 50,000 that was paid. Samuel from Naze also says that government hospitals most of the time are the cause of all of these things. That they wouldn't want to. I can't even remember what he said, but he complained mostly about the government hospitals. Mr. Kingsley, the last caller, pointed fingers at some of the consultants that we have. And then he says that majority of the consultants we have their own private hospitals where they refer people to. I don't know if you understand. Yeah. And then he said that he ended up paying 252,000 naira. The wife just delivered. So all of these things are challenges. So what do you have to say briefly, just quickly?
Honestly, we have said it all. If government should sit up and set regulatory bodies, it's not bad for someone to have a private where the person is practicing privately, whether he's or another person's home. It's not bad. But if we have regulatory bodies that SVD, that's safe vaginal delivery, should not exceed 40,000.
Okay.
And then make provision of the materials that will be used. I think these things we are complaining, we won't be talking about them. Let's take, for instance, when I wanted to start up my own, I had to import some materials from China.
Okay.
Then you have to clear them and do other necessary things, we're dealing and all that. These things are charges you will pay. How will you make the money? Is it not through these patients? They will be the ones to suffer. If government should at least build a company, factory, industries that will be providing most of these things we are using in Nigeria, we will have cost effectiveness. Someone will not deliver through the vagina and pay more than 40,000. That is just the truth. Everything boils down to the government. And when we are talking about individuals, if you are making a choice in hospital, choose the ones you can afford. Even if the consultant is compelling you to his hospital, the way the hospital are known, if it is something you can do. Some people will go because Mr. A went. You don't know how much Mr. A spent there. When I went to one private clinic for ENT, I purchased a card of 25,000 naira. At the end of the day, medications they gave me for 1 week costed 70-something thousand. And that was when I began to ask. I didn't present myself as a medical practitioner anyway. So that was when I began to ask, what kind of medication are you people giving me? They don't have names. So how will I take it? So on the course of that argument, I was now forced to say, I am a registered nurse midwife. The man now said, you didn't tell me. I said, but this is too much. Even if it is not in my profession, even if I'm not a professional like you, this is what you charge. Believe me, that medication did not cost up to 5,000 naira in the market.
For real?
And you are I'm telling you, you are charging me 70-something thousand plus 25 I have paid. That is 95. Assuming I don't have that kind of money, what will I do? Now, he said, we are paying for rent. This place alone is how many millions in a year? You see where the problem is coming in. I'm going to pay my staff. I'm going to take care of electricity bills. I'm paying for water. I'm paying for security. So if these things are being provided by the government,
you've not talked about signage. You've not talked about signage. You've not talked about Entraco. You've not talked about Ewamak and all the bills. I get what you're saying, Nurse Esther.
You see, so that is where the problem is coming from. Before I raise my signpost, I know how much I spend. Community will come and tell you are going to pay us for this. Local government will come and tell you. States will give you bill. Remember, last month I went for renewal. Something I did with 75,000 naira costed the 350,000 in the Ministry of Health. I was shouting, what is this thing all about? They said since the new government came, this is the challenges we have been facing. Now, at the end of the day, I have a family to take care of. How will I raise the money?
Okay.
Where two elephants are fighting, the grass will always suffer it. That is all I can say.
No, Sister, thank you so much. But I want you to comment briefly, just quickly, on the last person, someone who called to ask about Mirago, that is usually taken after delivery, and he wants to find out if that is harmful. And quickly, you summarize and give us your parting words. We have barely 3 minutes to go, please.
Oh, thank you very much. Like I have mentioned before.
Oh, the ice cream person does not want you to talk. Oh, Lord. The noise is something else. I don't know if you can move around a little.
Yes, we have reduced it. Thank you very much.
Go ahead quickly.
Thank you very much. The miracle they are taking, like I have explained, they are stimulants. Anything that will cause excessive stimulation to the uterus will lead the woman to postnatal anemia. Majority of them will not know. Do you understand? So miracle has no significant effects scientifically to do anything on the uterus. So you are taking it at your own risk and detriment. If you are taking it for taking sake, that is good for you. But when you are taking it to spare bad blood, there is nothing like bad blood. At the end of delivery, we will put our hand inside and remove every clot and ensure your uterus is well contracted. Check the volume of blood we have seen already and then take you back to the ward. After 2 days, we will check your post-hemoglobin to know whether you are fit to go home. That is it. Now, my parting words is, if you don't have money, don't go to the hospital you cannot afford. Having known we don't have a regulatory body and the cost of living in this Nigeria is so high, then government should employ skilled practitioners in these primary health centers. get those places equipped and well secured. One that was open close to where I am standing now. Robbers came and took away whatever. I don't know who are they. They took away whatever they have used to equip that place. So when you provide something without securing it, remember you are providing it for people that does not matter. So please, they should do something to that. Again, is cost of education in Nigeria. To produce a medical practitioner in Nigeria is not a child's play. Yes, I cannot spend millions to train my child in school, and you will come out to pay them 40,000 naira. I earned 40,000 naira as a nurse in a specialist hospital in Owerri as a contract. 40,000.
Don't worry, that's going to be a talk for another day. Trust me when I say that everything you have said, you're not far from the truth. And let's hope that the right authorities, people in charge, are listening, and the right things will be done going forward. Thank you so much for sharing your expertise with us, Nurse Esther.
Thank you very much.
You know I love you so much. Thank you. Okay.
I love you.
And
too.
I wish
You're
you the best
welcome,
going forward. All right, you just listened to Nurse Esther, a reproductive health provider and a specialist when it comes to maternal and child health. She loves to talk about it, and that's why whenever I have sensitive issues, I would always call on her, and she would never flop. She usually does justice to all the topics. Thank you so much. Messages on Facebook quickly, and then the BC says that his wife had a safe vaginal delivery, and the next day she was discharged, no more treatment, and he was billed a huge amount of money. Okay, in the BC, sorry about that. He also says, okay, my name is Michael. My wife gave birth 1 month ago in one of the private hospitals in Owerri, and he was billed 100,000 naira. He met the doctor in charge, and the doctor told him that 8,500 is for male baby. While 85,000 is for male baby, while 80,000 is for female baby, and that the 1,500 added is for treatment. Is that not surcharge? I don't understand. All right. That would be a talk for another day, but thank you so much for your message this morning, and that's the much we'll be taking on the messages. Yes, I have messages on WhatsApp, but unfortunately we are out of time. Thanks to everyone who tuned in this morning, and you heard what Nurse Esther said. Before you give birth, do your background investigations and find out the hospital that you can afford, okay? Before you go ahead to register for antenatal, please, and please, don't say because your cousin gave birth in that hospital, you would want to go there. Your pocket and his or hers might not be the same. So please do your background investigations properly and try as much as you can to afford, or rather, spend according to your means, okay? Thank you so much. And to our mothers-in-law, sisters-in-law, and our grandparents who would always want to, continue with those traditional practices, I understand where you're coming from, but the thing is, times have changed. We are in a new era, and the earlier we start to, get adapted to some of these changes, the better for us. My name is Mary Omeniwo. They call me the Slim Diva, your most adorable. In few minutes, we'll bring you the news at noon. Thank you for listening.
Almighty that created you and created we Nigerians like you. You need to do good things for us because the masses are suffering. How you can suspend me here? Are we your slaves?
And I'm going to win this election.
That is the truth.
Stay informed with Echo FM 100.7. Join us for exclusive interviews with experts, breaking updates on local and global events, and in-depth coverage of issues impacting our community. Tune in every day at 6:30 a.m., 12 noon, 2 p.m., and 6 p.m. for our major news bulletin in English, Igbo,
people, this na Tory time on top Echo
and Pidgin language. For more inquiries, you can reach us through our email, echofm@thekingmail.com. You can follow us on our social media handles at Echo FM. Echo FM 100.7 Owerri. We are the Fresh News People. It's the news at noon on Echo FM 100.7.
Good afternoon to you. It's the 23rd day of July 2026. This is the Global News at Noon right here on Echo FM 100.7 Owerri, the station with fair and balanced reporting. My name is Mary Omeni Wode, bringing you the latest news and breaking stories around the world. Here are the headlines. NGF orders unveil health security scorecard. Police top list as ICPC uncovers 908 ghost workers. Dangote resumes Naira petrol sales, hikes price by 140 Naira. On the foreign scene, drone strike on Sudan market kills 6, including children. And Russia strips rights of citizens abroad in sweeping new traitor law. And on sports news, EPL, Arsenal confirms extended injury layoff for Saliba. Details shortly. The Nigeria Governors Forum, in collaboration with the Nigeria Center for Disease Control and Prevention, the World Bank, and Resolve to Save Lives Nigeria, has unveiled a health security scorecard to strengthen the monitoring of states' preparedness for infectious disease outbreak and other public health emergencies. The scorecard was unveiled during a health security scorecard validation workshop in Abuja, where health experts and development partners described the initiative as a critical tool for assessing gaps in state-level health security systems and driving evidence-based interventions. Speaking at the workshop, the Executive Director of Programs Partnership at the NGF Secretariat, Dr. Ahmad Abdul Wahab, said the initiative was designed to establish a unified framework for evaluating health security governance across the 36 states of Nigeria. He stated that the scorecard would integrate key health security indicators into a single assessment tool to help governors monitor progress, identify gaps, and strengthen accountability. Meanwhile, the Independent Corrupt Practices and Other Related Offences Commission, ICPC, has identified the Nigerian Police Force and 5 federal ministries and agencies as having the highest number of suspected fake workers uncovered during its payroll verification exercise. ICPC Chairman Musa Adamu Aliyu San disclosed the findings while speaking on the Commission's investigation into payroll fraud across federal government institutions. The Commission stated that it discovered suspected 908 ghost workers in at least 50 ministries, departments and agencies, recovering about 942 million naira allegedly paid as fraudulent salaries. Among the institutions identified, the Nigerian Police Force recorded the highest number of suspected fake workers. The Office of the Accountant General of the Federation and the Federal Ministry of Interior were also listed amongst institutions affected by the payroll fraud. Although the ICPC did not disclose the number of suspected fake workers found in both offices. In another development, the Nigerian Customs Service has warned Nigerians to disregard a fake recruitment update circulating on social media, saying it did not originate from the service. The NCS urged members of the public to rely only on information released through its official communication channels for authentic updates on its activities, including recruitment. Recruitment scams have become a recurring challenge in Nigeria, with fraudsters often exploiting public interest in government jobs by circulating fake advertisements and soliciting money from unsuspecting applicants. Security agencies and government institutions have repeatedly warned citizens against engaging with unofficial recruitment notices. In a statement issued, the service said the recruitment update currently being shared on some social media platforms is false. The service advised Nigerians to verify information through its official platforms before sharing or acting on it. And news reaching us all the way from Lagos says disaster was averted after a gas-laden tanker caught fire along the Abaranje Road in the Ikotun area of Lagos. The spokesperson for the Lagos State Emergency Management Agency, Olawole Afolabi, disclosed this in a statement that the incident was swiftly contained by emergency responders with no loss of life or injuries recorded. Afolabi noted that the agency's response team arrived to find the tanker engulfed in flames, adding that preliminary findings showed that the tanker was traveling at a high speed when it struck a road bump, causing the driver to lose control. Afolabi stated that LASEMA officials worked closely with the Lagos State Fire and Rescue Service to extinguish the fire, secure the area, and prevent the blaze from spreading to nearby homes, businesses, and other road users. The permanent secretary of LASEMA, Dr. Olufemi, also urged motorists to obey speed limits, especially around speed bumps and residential areas. It's exactly 8 minutes past noon. If you just tune in, you are listening to the Global News at Noon right here on Echo FM 100.7 Owerri. Here's a recap of the headlines. NGF orders unveil health security scorecard. Police top list as ICPC uncovers 908 ghost workers. Dangote resumes Naira petrol sales, hikes price by 140 Naira. And still on the foreign scene, drone strike on Sudan market kills 6, including children. Russia strips rights of citizens abroad in sweeping new traitor law. And on sports news, still to come, EPL, Arsenal confirms extended injury layoff for Saliba. Details after this break. Stay tuned.
This is a public service announcement. In an effort to enhance road safety and minimize the risks of crash-related fatalities, Federal Road Safety Corps Imo Sector Command is urging citizens to promptly report any road crashes to the Corps Emergency Hotline. In the event of a road crash, citizens are advised to call the Corps Emergency Toll-Free Hotline at 122 to report the incident or any of the Imo Sector Hotline 0913 960 0904. Provide as much information as possible, including the location of the crash and the number of people involved. Stay on the line to receive guidance from the Corps Response Team. The Sector Commander urges all citizens to take an active role in promoting road safety by promptly reporting any road crashes. Together, we can work towards reducing the rate of
Echo FM 100.7 Owerri. And now, business news. The Dangote Petroleum Refinery has resumed the sale of premium motor spirit, popularly called petrol, in Naira, ending its brief dollar-denominated pricing regime while increasing its ex-depot price by 140 Naira per litre. The latest development comes 1 week after the 650,000 barrels per day refinery suspended truck loading of petrol and switched to dollar pricing. The resumption of Naira transaction was communicated to marketers in a notice issued by the refinery's commercial department. The notice showed that the gantry price of petrol increased from 1,075 Naira per litre to 1,215 Naira per litre, representing an increase of 140 Naira or 13.02%. The coastal loading price also rose from 1,441,575 per metric ton to 1,602,495 per metric ton. The notice signals the refinery's return to Naira-denominated domestic petrol sales after its brief migration to a dollar pricing regime that sparked concerns amongst marketers and consumers. Industry operators warned that the policy will significantly increase demand for foreign exchange, weaken the Naira, and push up petrol prices nationwide. Over now to the foreign scene, where a drone attack on a market in Sudan's North Kordofan state has killed at least 6 people, including 2 children, and injured over 26 others. The attack targeted the town of Al Rahad, injuring 6 children between the age of 6 and 14. According to UNICEF, repeated attacks are destroying homes, schools, health facilities, and markets, depriving children of health care and education. Attacks on key supply routes are also disrupting humanitarian operations and restricting access to vulnerable communities. Sudan's military announced that its forces seized control of the Fashoun area in Blue Nile State following clashes with paramilitary rapid support forces and rebels, marking another territorial gain days after recapturing the strategic border town of Al-Kamak. And still on the foreign scene, Russia's parliament has passed a law that will strip the property rights, bank accounts, and consular services of Russians living abroad who face prosecution at home on political grounds, in measures lawyers say amount to the de facto revocation of citizenship. The State Duma approved the bill in its second and third readings simultaneously. The State Duma Speaker, Volodin, also made no effort to obscure who the law was aimed at. Under the legislation, Russians living abroad who are evading criminal prosecution at home will face a sweeping set of restrictions inside Russia. The law also applies to Russians who have already been sanctioned administratively for violations of Russia's foreign agents law, for calling for sanctions against Russia, for calls to violate Russian territorial integrity, for discrediting the armed forces, or for involvement in organizations Russian duty with France at the FIFA World Cup. As reported, the 25-year-old centre-back had been managing the problem for several weeks before the tournament, but aggravated the injury during France's semi-final defeat to Spain, where he was forced off just after 30 minutes. Following his return to London, Saliba underwent further assessment by a specialist, with Arsenal confirming that surgery will not be required. Instead, the France international will begin a managed rehabilitation program. The injury also ruled Saliba out of France's third-place playoff defeat to England. Speaking earlier during the World Cup, Saliba admitted he had been playing through the pain to help both the club and his country. His absence is a significant setback for Arsenal ahead of the new campaign. And that's all for the global news at noon this afternoon, as was brought to you directly from our news desk. For more information and inquiries, visit our social media platforms on Facebook at Echo FM and Echo FM 100.7 Owerri, on X at Echo FM _Owerri, Instagram at Echo FM 100.7, and YouTube at Echo FM 100.7. You can listen to us anywhere in the world by visiting www.echofm.net, that is www.echofm.net, or you can search for us on Radio Garden with the name Echo FM 100.7 Owerri, Nigeria. My name is Mary Omeniwode. Thank you for listening and good afternoon to you.